This is the second in a series on bad therapy. That is, things that therapists do that are bad, often harmful or even destructive. Today I'll talk about something that can very definitely be harmful and destructive, and that is therapists that slide, often unwittingly, into romantic or sexual relationships with their clients or patients. Now, you don't need a video from me to know that that's plainly unethical. But you may wonder why it happens or how it happens. You may be surprised by the answer as it relates to some of the misleading messages that you'll see by influencers on social media. I'm Dr. Stephen Reedboard. As a psychiatrist and psychiatric educator with eons of experience, I challenge oversimplified or misleading messages that you see everywhere on social media. If you like what I'm doing here, please like this video and subscribe to More Than Meds. If you ask mental health professionals or even the general public, what's the first thing they think of when it comes to ethics in mental health care? The very first thing at the top of the list is don't have sex with patients. This is nearly universally agreed to be unethical. And there's a lot of reasons why. It ruins the therapy, it exploits a vulnerable person who put their trust in the therapist, might scare away potential future clients or patients from getting care. It's an abuse of responsibility and unequal power. But I'm not going to take your time in this video to make a case for why it's unethical. I don't think most of you out there need me to argue for that, and I'm never going to convince the few people out there who would want to argue that it is okay or that it is ethical. So instead, my interest is about how it happens. By the way, it's not only unethical. Therapists who have sex with their clients can lose their license. They can be subject to lawsuits hauled into court, and actually malpractice insurance doesn't cover that if they're found liable for sexual mistreatment. And in some cases, there's even criminal charges that can be brought against someone who does this. Every year I teach a course to psychiatry residents, doctors specializing in psychiatry, on psychiatric ethics. And my focus has always been to kind of put aside the do's and don'ts. We do cover that a bit, but mainly focus on the principles and the rationale and some of the psychology behind the ethical principles in my field. To me, the more interesting question is not, is it wrong, but what ethical principles does it violate? What's the reasoning behind it? And how can this happen? Are there evil therapists out there, sinister people who've decided to become a therapist, doing all those years of study, getting eventually licensed for the sole purpose of exploiting vulnerable people for sex? Are there therapists who plan to do this right from the start? I'm sure that occasionally happens, but I'm also equally sure that the great majority of cases don't happen that way. There's a saying that the road to hell is paved with good intentions, and this is a perfect illustration. Ethical wrongs follow from bad therapy. Let's say you're a straight male therapist and you're seeing a straight female client who's attractive but insecure. She complains that she's single and lonely and men never approach her and she's too shy to approach them. You're just sitting there in chairs in your therapy office, 8 or 10 feet apart, just talking. You want to help this person feel better about herself, right? That's what therapists do. Plus, the truth is, if you were being honest with yourself, it's kind of nice to spend an hour a week with an attractive woman in the office talking to you in confidence, especially when your own private life isn't so hot and she obviously admires you and looks up to you. So without thinking about it too much, you tell her that you find her attractive and that you'd date her if you weren't her therapist. You figure that'll make her feel better. And instead of cringing or being offended and complaining, as I'm sure many of you out there would imagine you would do in response to that, instead, she takes it as a compliment and returns a warm smile. After all, she has a positive transference towards you as the therapist. You come across to her as caring and wise and an incredibly good listener. You might say she has an emotional need to see you that way, and let's be honest, the therapy situation itself encourages it. By the way, I talk about transference in this video right here. The good vibes make you both feel warm and connected, and at the end of the session, for the first time ever, you give her a little platonic hug on the way out the door. Now, I won't play this out any further in detail. I think you get the idea. It progresses. There's hugs at the end of the session, and then maybe at the beginning and the end of the session, and then maybe it goes on to a little bit of cuddling because that makes her feel good too. And then maybe it becomes meetings outside of the office and so on and so on. Of course, I started with the stereotypical male therapist and female client, but it can be any combination. It can be a female therapist and a male client, or any of the possible combinations that go under LGBTQ+. Note a few elements in my story. Number one, the therapist imagines they're gratifying the client or patient, not themselves. They're in denial about their own motivations. And of course, that way they can justify doing it. Number two, the client actually is gratified in the moment. If they were offended and recoiled and said, "How dare you," or something like that, that would be the end of this story, maybe the end of the therapy as well. But it takes both parties initially feeling like it feels good. Number three, positive transference, which is a very common and expected phenomenon in psychotherapy, makes this all more likely. And number four, it's a slippery slope. Nobody set out at the beginning to have sex with anybody else. One thing led to another. It's important to emphasize that the fundamental structure of psychotherapy is that the therapist creates a safe space in which the client can be emotionally vulnerable. This means it's the therapist's job to maintain the boundaries. When these cases get pulled into court, for example in a lawsuit, sometimes the therapist will claim that it was the client's idea, or even that the client insisted that they have a physical relationship. Whether that's true or not, it doesn't matter. It's still the therapist's job to maintain the therapeutic frame, the structure in which therapy operates, so that vulnerable feelings can be expressed. If that frame is violated or damaged or weakened, it's on the therapist every time. Are there warning signs that something like this is potentially happening? The answer is yes. Be on the lookout for unusual arrangements. There's a lot of examples of this. Intimate seating arrangements. The therapist wants to sit on the couch with you instead of in chairs opposite each other. Seeing you at odd hours, outside of normal business hours, unless that's the therapist's normal practice. Extending sessions for no good reason, not because of a particular crisis that day, but just because it's nice to talk. That's not professional psychotherapy. That doesn't maintain the frame. Having therapy over a meal, like having therapy over lunch or something like that. Mixing a professional service with a social activity. Offering to give you a ride home. Again, having a kind of relationship outside of the office. And all sorts of different kinds of financial arrangements, bartering, quid pro quo, gift giving, lots of things that fall just outside of the idea of simply paying a therapist for a psychotherapy session. These can introduce confusions about whether something's a payment versus a gift, whether there is reciprocity expected. You know, I gave you something, you need to give me something, and so forth. And that's just one category, which is unusual arrangements. Another category is what we call dual relationships. That's when you have more than one kind of relationship with the same person. This person is your psychotherapist, but they're also your golf buddy, or the person you go bowling with, or somebody you have a business relationship outside of therapy. Or you find yourself doing favors for your therapist outside of therapy, like getting lunch for them or getting them a coffee or something like that. Again, it starts to ease into a social relationship and not a professional one. The third category is therapist self-disclosure, when therapists talk about their own private life. And this isn't always a warning sign, but particularly if the therapist starts to mention something about being in a bad marriage, or they're lonely, or their own social life is not so good, that should be a very clear warning sign. And last but not least, anything that a therapist does or proposes to do that they wouldn't do with a client who was not your gender. So I ask you, and also any therapists who are watching this, if you feel inclined to give your client a hug at the end of a session, would you do that with a client who is just the same kind of person but a different gender? Because if not, maybe that isn't for their benefit. Again, none of these are likely to be conscious grooming activities carried out with the conscious intention of eventually getting the person into bed. It can be that, but much more often it's not. It's a lot more likely that the therapist is just getting carried away and not thinking things through. As a client or patient, it's always a good idea to bring up feelings of discomfort, or if something feels weird or icky or cringy in a psychotherapy session. Your therapist should be okay with talking with you about that. And you can make your own assessment about whether the conversation is going in a direction that you're comfortable with. Feelings are information. Pay attention to them. So why did I relate this at the beginning of this video to misleading messages on social media? After all, you're not going to hear many influencers explicitly say that therapists should try to have sex with their patients. On the other hand, it's very common for social media voices to kind of wave away the formalities of traditional psychotherapy. Instead of maintaining professional decorum, instead everybody's on an informal first-name basis with each other. The therapist talks about him or herself a lot to make the conversation seem more quote-unquote normal. Many times you'll hear about the advantages of adding a little physicality, whether that's a hug or holding hands, to add to the humanity of the therapy situation. At the same time, most don't even recognize the existence of transference, much less the way transference can distort the judgment of a client in the middle of psychotherapy. Many say that therapists need to bring their whole selves to therapy, by which they imply that therapists should talk about their own needs and vulnerabilities. It's a seductive set of messages, but it's very risky. One of the secrets of good psychotherapy is that it allows the emergence of strong feelings without real-life consequences. Clients or patients can be enraged or jealous or competitive or erotically turned on, even with respect to the therapist, and nothing happens but talk. It's safe to feel those feelings because, unlike in the rest of life, bad things don't happen. The client doesn't lose their job, they don't get evicted, they don't wreck their marriage, They don't get into a fling with somebody that they shouldn't. In a safe psychotherapy setting, they can let their feelings emerge to learn more about their own emotional landscape and to learn more about the strength of the feelings they've been hiding from themselves. That is, unless they're unlucky enough to be working with a therapist who listens to, or actually is, one of those social media voices that endorses those things I've just been talking about. Now, it's true that some of those things in isolation are not necessarily warning signs. There's nothing wrong with being on a first-name basis, for example, if both parties are comfortable with it, and if the therapist is nonetheless maintaining a clear therapeutic frame. But pile too many of those influencer ideas one on top of the other, and pretty soon there is no therapeutic frame. At that point, the client's strong emotional feelings can have real consequences. Such a therapist may take it personally when the client has strong negative feelings or is enraged at the therapist for reasons that have to do with transference, or equally personal when an erotic transference opens the door to a physical encounter. That's a therapy fail. In contrast, what do good therapists never do? They never forget to maintain the frame that keeps therapy safe. They never engage in dual relationships with clients, like socializing or having a business relationship outside of the office. They never take it personally when transference is at play. Those feelings are not really about them. It has much more to do with the role they are in as a therapist. They never try to justify or rationalize behavior that they know is out of bounds for psychotherapists. They never ignore slippery slopes. And if they never do any of those things, they'll also never have sex with a patient or client. It's not the ethical rule that prevents it. It's the principles behind the ethical rule and the psychology of doing good clinical work. Please comment on therapists maintaining a safe frame in therapy, either generally or more specifically regarding physical safety. Let me know other bad things some therapists do. Maybe I'll put it in a video. Please like this video, but only if you really like it. Please subscribe if you have not already. And these videos about bad therapy and bad therapists are part of a playlist, and here's the playlist. I'll see you next week.